5 subtle signs that an elderly person may be in their final year, key warnings you can't ignore. As we age, our bodies and minds begin to show signs of decline. For elderly people, certain subtle signs may indicate that they are entering their final year of life. These signs may not be immediately obvious, and often, we overlook them because they seem like normal parts of aging. However, understanding and recognizing these signs early is crucial, not only for providing the best care for our loved ones but also for ensuring that their final months or year are filled with comfort, dignity, and peace. Let's take a deeper dive into the 5 subtle yet important signs that could indicate that someone is in their final stage of life. Recognizing these early will allow you to provide the proper care and make the most of the time you have left with your loved one. 1. Significant weight loss, a key indicator of decline. Unintentional weight loss is one of the earliest and most noticeable signs that an elderly person may be nearing the final stage of life. At first, the changes can be subtle: a tightening belt, clothes that seem looser, or a decrease in appetite. While these may seem like normal aspects of aging, significant weight loss often signals a deeper issue. It could mean that the body is no longer absorbing nutrients properly or that vital systems are slowing down. This can happen for many reasons, including muscle loss, changes in metabolism, or the body's inability to process food effectively. Aging naturally causes muscle loss, but when it happens rapidly, it's usually a sign that something more serious is happening. The elderly person may become more frail and experience muscle weakness, making it difficult to move or engage in physical activity. Additionally, weight loss often leads to a weakened immune system, increased susceptibility to infections, and a higher risk of falls. If your loved one is losing weight unexpectedly, especially if they are eating less or feeling weaker, it's time to take notice. This isn't just about appearance, this is the body sending you a message that requires attention. Sometimes, families try to remedy this by offering high-calorie meals, protein shakes, or favorite foods. But if weight continues to drop despite these efforts, it's important to realize that the issue is more than just diet, it's the body preparing for a final transition. Instead of forcing large meals, focus on offering smaller, easier to eat foods, hydration, and comfort. It's a shift in how we approach care that acknowledges the body's needs at this stage. 2. Extreme fatigue and weakness, the body conserves energy. Another key sign that an elderly person may be approaching the end of life is extreme and persistent fatigue. Unlike ordinary tiredness that comes and goes, this fatigue is overwhelming and doesn't seem to improve with rest. The person may struggle to get out of bed, walk across the room, or perform even the simplest daily tasks. They may begin to withdraw from activities that once brought them joy, as their body's energy reserves are depleted. This fatigue is often a sign that the body is conserving energy. As we age, our organs start to slow down, and the body redirects energy toward only the most vital functions. The heart pumps less efficiently, circulation weakens, and muscles receive less oxygen. This energy shift can cause elderly individuals to sleep more, take longer naps, and struggle to stay awake for long periods. It's also important to recognize the emotional toll this takes on the individual. Many seniors who were once independent and proud of their abilities may feel embarrassed or frustrated by their increasing lack of energy. As they struggle to complete tasks, they may withdraw from social events, hobbies, or conversations. Family members often mistake this withdrawal as laziness, but it's not. It's a physical and emotional response to the body's decline. At this point, the best thing you can do is to meet them where they are, be patient, offer comfort, and allow them to rest when needed. This is the time to cherish the quiet moments and focus on making their remaining days as peaceful and comfortable as possible. 3. Increased confusion and withdrawal, a decline in mental clarity. One of the more emotional signs that someone is approaching the end of their life is the decline in mental function. A person who once had a sharp mind may begin to forget things, struggle to follow conversations, or get confused in familiar places. They might repeat themselves, forget names, or lose track of time. These changes, while alarming, are often subtle at first and may be brushed off as normal forgetfulness. However, these cognitive shifts are usually more than just the typical memory loss associated with aging. As the body prepares for the final stage of life, the brain begins to slow down as well. Blood flow decreases, and oxygen levels drop, which can cause confusion, difficulty making decisions, and even challenges with recognizing familiar faces and places. In some cases, seniors may experience brief moments of clarity followed by periods of confusion, almost like their mind is fading in and out. Along with cognitive decline, emotional withdrawal is also common. The elderly person may lose interest in socializing, avoid conversations, or spend extended periods in silence. It's not that they no longer care about their loved ones, but rather that their brain is no longer processing emotions the way it used to. Conversations may become overwhelming, and familiar environments may feel like too much to handle. For family members, watching a loved one lose their mental clarity and withdraw emotionally can be heartbreaking. But it's important to understand that this isn't something the person can control. The best thing you can do is provide comfort and reassurance. Be patient, speak gently, and meet them where they are emotionally. Even if they can't respond the way they used to, they can still feel your presence and love. For frequent infections and slow healing, a weakened immune system. One of the most telling signs that the body is reaching its final stage is the increased frequency of infections and slower healing. As the immune system weakens, the body becomes more susceptible to infections, even those that were once easily fought off. Pneumonia, urinary tract infections, and skin infections may occur more frequently and take longer to heal. Even minor cuts or bruises may take significantly longer to close up. This is a clear sign that the body is no longer able to protect or repair itself effectively. As circulation slows and organs weaken, the body's ability to respond to treatment diminishes. Even antibiotics, which once worked efficiently, may take longer to have an effect, or may require more rounds of treatment. For families watching a loved one go through repeated infections, it's tempting to push for stronger treatments, hoping that one more round of antibiotics or a hospital stay will fix the problem. But it's important to remember that at a certain point, the focus of care should shift from curing to comforting. Keeping the person hydrated, ensuring proper skin care, and reducing stress on the body can provide more relief than further aggressive treatments. This is a difficult transition, but recognizing it early allows you to provide better care during these final months. 5 major changes in breathing and circulation. The body slows down. As the end of life approaches, you may notice significant changes in the person's breathing and circulation patterns. Breathing may become more shallow, slower, or irregular. In some cases, people may experience periods of rapid breathing followed by long pauses between breaths. This is known as Cheyne-Stokes respiration, and while it can seem alarming, it is a common sign that the body is beginning to shut down. Another key sign is a reduction in circulation, especially in the extremities. Hands, feet, and even the nose or ears may feel cold to the touch, and the skin may appear pale or have a bluish tint. This occurs because the body is prioritizing blood flow to vital organs, like the heart and brain, while reducing circulation to less critical areas. This change in breathing and circulation is often accompanied by increased shortness of breath. The person may struggle to catch their breath after minimal movement, such as sitting up or speaking. Fluid buildup in the lungs can also cause difficulty breathing, leading to a constant cough or gurgling sounds. These changes are a normal part of the body's decline, but they can be distressing to witness. At this point, it's important to focus on comfort rather than trying to reverse these changes. Providing a calm environment, keeping the room cool, and using a humidifier can help ease breathing. In some cases, medications or oxygen therapy can offer relief, but the primary focus should be on making the person feel as comfortable as possible during this time. How to enhance the health and longevity of elderly individuals, practical solutions. While it's important to recognize the signs that may indicate a decline in health during the final stages of life, it's equally crucial to focus on proactive measures that can help improve the quality of life for seniors. By implementing some lifestyle changes and focusing on overall well-being, elderly individuals can not only enjoy a more fulfilling life but also extend their longevity. Let's explore some effective solutions to help our loved ones live healthier, longer lives. 1. Balanced and nutrient-rich diet, fueling the body for longevity. One of the most important aspects of maintaining good health as we age is a proper diet. Nutrition plays a significant role in how well elderly individuals feel physically, mentally, and emotionally. As we age, our metabolism slows down, and the body may not absorb nutrients as efficiently as it once did. Ensuring a nutrient-dense diet is vital in combating these changes. Key tips. Protein intake. Adequate protein is essential for maintaining muscle mass and strength. As mentioned earlier, muscle loss can be accelerated in older adults, leading to weakness and increased risk of falls. Foods like lean meats, eggs, beans, and legumes should be incorporated into daily meals. Vitamins and minerals. Seniors need higher amounts of certain vitamins and minerals, such as calcium, vitamin D, and B12. Calcium and vitamin D are essential for bone health, reducing the risk of fractures and osteoporosis. Foods like dairy products, leafy greens, fortified cereals, and eggs can help provide these nutrients. Hydration. Many older adults become less sensitive to thirst, leading to dehydration, which can cause fatigue, confusion, and other complications. Encourage elderly individuals to drink water regularly, even if they don't feel thirsty. Adding electrolyte-rich drinks or herbal teas, like chamomile or ginger, can also help. Smaller, more frequent meals. Due to changes in appetite and digestion, seniors may struggle with large meals. Offering smaller, Nutrient-dense meals throughout the day, combined with easy-to-digest options, can ensure they receive the necessary nutrients without overwhelming their systems. 2. Physical activity, keeping the body moving, even gently. Physical activity is one of the most important factors in promoting longevity. Regular exercise helps keep the muscles strong, improves circulation, and boosts mood. However, as we age, intense workouts might become more difficult. But the key is gentle, low-impact exercises that can maintain flexibility and strength without putting undue stress on the body. Key tips. Walking. Encouraging daily walks is one of the simplest ways to keep elderly individuals moving. Walking not only improves cardiovascular health but also strengthens bones, supports mental clarity, and combats feelings of depression. Stretching and yoga. Gentle stretching exercises or yoga can help improve flexibility and mobility, reducing the risk of falls and muscle stiffness. Simple stretches can be done in the comfort of the home and can significantly improve range of motion. Strength training. Lifting light weights or using resistance bands can help maintain muscle mass and bone density. Strengthening the core and lower body muscles helps prevent falls and supports better balance. Water exercises. Water aerobics or swimming are excellent forms of exercise for older adults, especially those with arthritis or joint pain. Water's buoyancy reduces strain on the joints while still providing a great workout for the body. 3. Mental and emotional well-being. Maintaining cognitive function and emotional health. Mental and emotional health is equally as important as physical health, especially in the elderly. Cognitive decline, depression, and anxiety can affect the quality of life, and it's essential to incorporate strategies that promote mental well-being. Key tips. Mental stimulation. Encouraging activities like puzzles, reading, playing memory games, or learning new skills can help keep the mind sharp. Activities that engage the brain have been shown to reduce the risk of cognitive decline and improve memory function. Social interaction. Socializing with family and friends is crucial for emotional health. Isolation can lead to depression and loneliness, which can exacerbate physical health issues. Make time for social activities and encourage them to engage in community events or group hobbies. Mindfulness and meditation. Practices like meditation, deep breathing exercises, or mindfulness can reduce stress, lower blood pressure, and improve overall mental health. Even just a few minutes a day can have a profound effect on emotional well-being. Sleep hygiene. Encouraging good sleep habits is vital for cognitive function. A regular sleep schedule, a comfortable sleep environment, and reducing screen time before bed can improve the quality of sleep, leading to better memory retention and mood stability. 4. Regular health screenings and medical check-ups. Preventative health care is key to detecting and addressing health issues early. As we age, the risk of developing chronic diseases increases. Regular medical check-ups, screenings, and early detection can ensure that any issues are addressed before they become severe. Key tips. Routine check-ups. Ensure that your elderly loved one attends regular check-ups with their primary care physician, even if they're not feeling ill. Regular blood tests, blood pressure checks, and general physical exams can help identify issues early. Chronic disease management. For those with chronic conditions such as diabetes, hypertension, or heart disease, managing these illnesses is crucial. Regular visits to specialists, adherence to prescribed medications, and lifestyle changes can significantly improve outcomes. Vaccinations, staying up to date on vaccinations, including flu shots, pneumonia, and shingles vaccines, is essential for preventing serious illnesses, especially as the immune system weakens with age. 5. Creating a safe living environment, preventing falls and accidents. Falls are one of the leading causes of injury and hospitalization in the elderly. Creating a safe living environment is essential to maintaining physical health and preventing accidents. Small adjustments can make a huge difference in ensuring the safety and comfort of elderly individuals. Key tips: remove hazards, ensure that the home is free of tripping hazards like loose rugs, cords, or clutter. Install handrails in bathrooms, along stairways, and in hallways to help with mobility and stability. Lighting: proper lighting is essential for preventing falls. Ensure that all areas of the home are well lit, especially hallways and staircases, and that night lights are used in bathrooms and bedrooms. Assistive devices: encourage the use of walkers, canes, or other assistive devices if necessary. These tools can greatly improve stability and mobility, reducing the risk of falls. The bottom line: prioritizing health for longevity. While it's important to recognize the signs that an elderly loved one may be approaching the end of life, it's just as vital to focus on improving their health and quality of life to help them live as long and comfortably as possible. By adopting healthy lifestyle habits like proper nutrition, physical activity, mental stimulation, and regular health screenings, elderly individuals can enjoy a longer, more fulfilling life. And by making small adjustments to their environment and offering support, families can ensure that their loved ones remain safe, comfortable, and connected. Ultimately, it's about balance. While the inevitable changes of aging may come, there's so much we can do to enhance the quality of life for our elderly loved ones, allowing them to live with dignity, joy, and peace. When we embrace these strategies and approach aging with compassion and awareness, we empower our elderly loved ones to enjoy the final years of their lives with the best possible health and well-being. While it's important to recognize the subtle signs of decline in elderly individuals, it's equally crucial to take proactive steps to improve their overall health and quality of life. Through proper nutrition, regular physical activity, mental engagement, and ensuring their environment is safe, we can help our loved ones live not only longer but healthier, more fulfilling lives. By focusing on holistic well-being and understanding the changes their bodies and minds may go through, we can be better prepared to support them through their journey. Remember, every moment with our elderly loved ones is precious, and by embracing these strategies, we can make sure their final years are lived with the respect, care, and love they deserve.